70 to 85% of what physicians need comes out of our laboratories. It's so important that we get it right from the get-go.
You go get your blood drawn, comes up to the lab, we process, spin it down, separate it into the different departments, and then we run it. And we make sure that the results are accurate, that they're within the ranges that we're kind of expecting to see. And then it just goes back, gets reported to the doctors, the nurses, and we just kind of keep them happy.
They decreased their turnaround times from about 54 minutes. We are under 30 minutes now for turnaround times, and some of our assays are even out in 15 minutes.
Through the past year, we've brought more and more testing in-house, and that's really reflected our turnaround times, because before we'd have to send them to Utah or California. And so not only are we getting quicker turnaround times, but we're saving a lot of money by bringing all these tests in-house.
Laboratory has gobs of data, as you can imagine, mountains of it, because we do 1.7 million procedures per year. It's about 7.6 million tests per year out of this laboratory.
We have lots of different tests and types of cultures that we do, and we're able to tweak things on an ongoing basis to make them work so we're more efficient. Every change that we make impacts our workflow, so it enables us to stay dynamic.
We brought in this instrument that took 12 instruments and became one. And so you throw a tube on and it's increased the turnaround time significantly. It takes about 10 to 15 minutes to run a specimen, but it doesn't include all of the time that it takes to get from the nurse's stations to here to whatever. So that turnaround time seems like a long time, but it's really from collection to when we get it here in the lab, spin it down, give it to the department, and then it gets resulted.
Well, now we put it on an analyzer. It carries it through the tray. It dips the specimen, it dips the reagents, and it reads it.
It's a cost savings on employees because we don't have to have as many employees running all the different instruments. And we're always developing new testing.
Instead of being just stuck with what we have, we can change it and make it work better for us.
We just look at it. Is there standard work we can do so that everybody's doing exactly the same, and then they can come back and the next person knows exactly where that person was and they can pick up the work without a failure.
A lot of the testing that we do helps the clinician, the care provider, in diagnosing clinical disease, especially infectious disease, and then what to treat that patient with, especially antimicrobial treatment. So we have to be accurate.
It's not about the data. It is about what we do with that data for better outcomes. When we do make errors or see issues with our testing, it's getting back to what was the causative agent of that and trying to improve the process for that, because it's not people that are broken, it's the processes that are broken.